For me, the most important thing that came out was the discussion of cost effectiveness and value of cancer care, as that was an area that was fairly new to me. I would be quite interested to explore the issue of value frameworks and what value means to different stakeholders.
The big elephant in this Congress is the value, is the problem of the cost of the medicine and this innovative medicine, were not tenfold but 100-fold more than the system can absorb in the next years. And for the first time, for me it's the first time that the problem of cost and the sustainable system for the next future, not in a century but for the next year, are so big. And it's very interesting to see what's the push and the pull on the sector, and this Congress was perfect for understanding.
I have learned that pricing is a big problem we are not talking about, and I do want to investigate more about that because it is a big issue and it's the elephant in the room. I don't understand why we are not talking about it.
So I've been here with two aims. The first was to learn something more about immunotherapy and personalized medicine, and the second aim was to learn more about indicators, health indicators, to judge if health in my country is okay, when we have to improve, where we are. My main story will focus on immunotherapy and especially the main challenges and the open question about this field. I've learned many things. One is that immunotherapy has many challenges. It is reality for some kind of cancer, for some kind of patients, but not for all people. And another thing I have learned is the patient involvement, engagement in research and also into healthcare management.
What I learned at the conference is how important the patient role is in designing trials, how important it is to hear the patient's voice, but also at the same time how little it is often heard. We as journalists often put patients shoehorn them into a certain picture that we'd like them to be, but recognizing that patients actually have their own views and agendas and maybe priorities that are different from what we would expect them to be.
One important thing was about the patient's view, how they view themselves, how they view the journalists, what they think, what they need, and what they expect from us, because I never had this kind of feedback.
The most attractive thing about reporting on cancer is telling about patient stories, because I think, or at least I want to think, that these kind of stories are the most useful for other people struggling with the disease, and maybe they can find some kind of guideline or inspiration in people who is in the same situation they are.